Preparing to live stream the webinar.
Eileen, it's telling me that the webinar is streaming live on YouTube.
Mm-hmm. But it's not quite. Oh, there it is. Okay, I'm gonna, we've got 2 attendees thus far, so I will just go ahead and turn it over to the chair.
All righty. Good afternoon, everyone. I've got the time as 12:03. We'll call this meeting of the Board of Health for Elbert County to order. Amanda, could you call the roll, please?
Commissioner Richardson,
Here.
Commissioner Thayer,
Here.
Commissioner Pettit,
Here. Alrighty, and we're joined by County Manager Sam Elbert and Director of Public Health Dwayne Smith, and Eileen Croth is in the background pushing slides and keeping us organized. So I'd like to welcome the members of the public that we also have watching as members of either the Zoom conference or streaming online. But with that, I'll turn it over to you, Dwayne.
Okay, thank you, Commissioner. Good afternoon, everyone. Let's start with a few kind of general comments and updates on the virus, and then we'll get into the agenda. Currently, Elbert County is trending in a not so great direction, but I want to emphasize that this virus is beatable, but we have to actively fight it. I believe earlier this morning, CDC's Director Robert Redfield commented in a hearing before Congress, I believe it was the Senate, that our best defense currently against the virus is face masks. Face mask use waxes and wanes. It seems like when people are more inclined to wear them, generally the virus is in decline. But around holidays and other kind of community gatherings, when folks are less likely to wear the mask, then we see a subsequent spike. So what do we know about this virus at this point in time? Well, much of the virus is highly clustered in Elbert County. We see a lot, we have been seeing a lot of familial transmission. Whereas everyone that gets the flu is more or less evenly infectious, with COVID-19, a small number of people are highly infectious. And there are a small number of places where the virus is highly spreadable. So compared to other viruses, we'd obviously much rather not have asymptomatic spreaders and pre-symptomatic spread, but fortunately, not everyone that's coming into contact with the virus is getting it. It's not like the measles, where one infected person, everyone that comes in contact with that one infected person is going to result in 90% of those people in contact with them coming down with the measles. This is not the measles, but we're still experiencing significant challenges. Most importantly, knowing who and where are the important mysteries to solve. We've figured out the where. That's cramped places, indoor spaces with poor circulation, and also with loud talking and laughing like you would see in a bar. Figuring out the who is infinitely trickier. We know that kids shed the virus. We know adults shed the virus. We know that some people shed a lot more of the virus than do others. There's a mixed view, though, as to who exactly that is that sheds it more than others. The view towards kids is we know that they shed, but we have very little idea why they don't shed to adults. In most cases, the virus is going from adult to child. or adult to adult course. There's still much more about this virus that is unknown and is actually known. That's something I think I've repeated in every Board of Health meeting since the inception of the virus. However, we do have lots of tools to fight it. It requires diligence in avoiding places, and diligence in wearing face masks, and diligence in social distancing. Social distancing is actually a privilege, but we forget that because it feels like a hassle. But the reason that the more time goes on, the more this is infecting and afflicting immigrant, Latino, and essential workers, essentially for that reason. Some places and some jobs have the deck stacked against them. In the example of public housing or manufacturing and food processing facilities. Folks exposed in those environments are infinitely more likely to contract the virus from an infected person. In reading some of the literature, sociologists have shared that as people feel less personally at risk, the pressure on them to stay safe subsides. White communities, suburban communities, and college kids don't keep up the difficult habits that are necessary to keep the virus at bay. This has been seen in, for example, at CU Boulder, in a particular community on I believe it's the College Hill neighborhood, where they are trying to do all they can to keep it under spread. That's where a lot of students and undergraduates reside that attend school there. And there was, on a call earlier this morning, a mention from Sarah Thunberg, who is the lead for CDPHE's testing protocols, that looking at statewide cases in Colorado, in the last several weeks, nearly 40% of the cases in Colorado are in the 18 to 23-year-old age group. That's significant. Unfortunately, we don't have, for purposes of the virus spread, we don't have an institution of higher learning where we have that significant concentration of that age group. Thinking about the immunity to the virus, the better informed they are, the less scientists pretend to understand immunity. This is still an area that is more information, more exploration, more understanding is greatly needed. Earlier in the year, for example, we thought, or we questioned whether or not people could get reinfected with the virus after a few months. We now know that they can. How likely are they to get reinfected? How bad is that reinfection going to be? We still don't know. Will those who have lost their immunity, will those that have been infected lose their immunity in a year? Again, no one really knows. I don't think so, personally, but obviously it can't be known. Another question or topic of conversation in recent media is herd immunity. When does herd immunity slow down the virus? It's still unknown, but the consensus is likely only a small bit, if at all. So let me talk a little bit about asymptomatic testing. Everyone believes that it's vital to continue testing folks that are not exhibiting symptoms until we have the virus well under control. So what's the next big innovation in testing? Saliva test prevalence is growing, and hopefully at-home testing is only a few months away. Just before this call, I was on a separate call with CDPHE that focused on a test called the Cumulative test kit that is being distributed to rural and frontier counties around the state. As the state, and forgive me, I'm looking at my notes here, as the state is in the process of closing down the large-scale testing sites, like at the Pepsi Center at the end of September, and I think the Aurora Sports Park will close in October sometime. Testing will transition to primary care providers and federally qualified health centers and other partners. Obviously, we don't have a whole lot of options in that space in Elbert County, but one that is coming our way is this curative testing. It is a test for symptomatic individuals. We will be getting, Elbert County Public Health will be getting 1,150 of these test kits. They're individually packaged. There is a 48-hour turnaround from when the test is received at the lab. The lab is in LA County in San Diego, California, to when the results are provided. It's an oral fluid test. The state's already purchased them and paid for the shipping. There's no cost to us as a local public health agency. Once the test is collected, the sample has a 5-day window of viability. So that's certainly enough. And they're going to be utilizing UPS, parcel service, and next day air to run the test from the UPS facility, to transport the test from the UPS facility to California.
And Dwayne, did you say that was a test specifically for people that are symptomatic, or?
Correct. That's correct.
Okay. So, and then the at-home testing that you said might be coming, is that an at-home? I mean, does it still need to be packaged up and sent to a lab, or is that some sort of instant testing?
Yeah, sorry if I confused those two thoughts.
Yeah.
The at-home testing, I'm not, this curative test, I'm not talking about the at-home testing.
Okay.
That's still a couple months away. The option that will be coming soon, we'll need to identify how we're going to do this through partners. Could be as easily done theoretically through a nurse at the school district, or certainly Peak Vista, or another primary care provider. This test, it again is for symptomatic individuals. It is meant to support rural and frontier communities that don't have easy access to testing, or it's not convenient for Elbert County residents to go to Colorado Springs or to Aurora or to Denver. So it gives us another option. It's not meant to supplant any existing testing options, but it'll be another test in the testing regimen. So sorry for conflating those two thoughts.
No, I don't think you did. I just wanted to kind of clarify. And you said if there are 1,000 coming our way, we've had 138 confirmed tests. I'm assuming a portion of those are asymptomatic but tested because of exposure. So, I mean, 1,000 tests would cover people truly symptomatic for a long period of time, or, So anyway, that's a good number, at least in terms of covering those that may be symptomatic.
Yes. So. And for example, if we suspected a teacher or students at school potentially exposed, we could work with the school district to administer the test to those students that were isolated initially, and hopefully reduce the number of days where students or faculty potentially would need to be out of school or transition to online learning. The 1,150 test kits is a start. It is not a one-time shipment. Obviously, we'll need to exhaust that supply, but the thinking is that this will be available for resupply, restocking as needed. And distribution was population-based. I think they took, they had a low number for our population as usual. They took about 5%, and that's where they arrived at the 1,150 test kits. So now's probably a good time to transition to the first slide and the current status of COVID in Elbert County. We have had 138 confirmed cases to date since mid-March. And these numbers were pulled on Monday. We have had, I believe, 2 cases subsequently. So as of this morning, I believe we're at 140 cases. Our 2-week cumulative incidence rate as of Monday morning was not quite 64 cases per 100,000. Our positivity rate, our 2-week average, is hovering around that 5%. It has, I believe yesterday it was slightly above 5%. This was on Monday, slightly under 5%. So we're right at that point of demarcation where resumption of normal activities moving forward, and how I determine parameters and decisions for requests for community gatherings or community events or things like that. This is one of the metrics that is certainly something we look at in a very telling and important metric. Our average age, we're still doing pretty good, a little over 47 years old. That is higher than most of the state. I believe the statewide average is still in the mid to high 30s. Our median age is 50 years old. Our range has not changed. We have had an infant, that is correct, a 9-month-old. We have had a 95-year-old test positive for the virus. To date, this slide shows not quite 1,900 residents tested to date. That is over 1,900 now, probably about 1,920. We have had 3 fatalities, and this slide shows 23 hospitalizations. There's actually been 1 subsequently, so we're at 24. One thing I can share anecdotally from our contact tracer, who speaks with everyone she can get a hold of that's infected. The lingering effects of folks that have been infected. This is not something that, someone gets infected and they have the virus run its course and then they're back to a baseline level of health a short while thereafter. One of the common comments from those infected is that 3 weeks, 4 weeks, sometimes longer, they're still not feeling well. So that is an area of concern. I don't know exactly why that is, but it's something we're keeping an eye on. Next slide, please, Eileen. This slide, I just want to point out that of the 64 counties, and there is 1 county that is yet to have a confirmed case of COVID. So with an N of 63 counties, Elbert County is doing fairly well. So we rank 41st among the 63 counties that have had infections. Next slide, please. Our 2-week cumulative incidence rate. You can see here earlier this week, I guess this was on Monday, we have been steadily creeping up. Probably over the last 2.5 weeks, we've had a steady trickle of cases, 1 case a day, 2 cases a day. In the case of familial transmission, I think we've had, one day we had 4 confirmed cases, but 2 each. One was a husband and wife, and another was in the same household. The other 2 were in the same household. So 2 separate infections, if you will, that affected 4 people. So next slide, please. The geography of the county, this may not be clear, but if you can imagine the borders of the county roughly around the margin of the black area, you you can see that the density of cases is almost exclusively in the western third of the county, with some additional density in the northwest part of the county, near the Arapahoe and Douglas County neck. Next slide, please. So where are the cases? Of the test results where there was a zip code available in the information, I'll let you read the volume of cases there, but predominantly in Elizabeth, I should say 80107, I've got an extra digit in there, 80107, and Parker have yet to have a case in Simla, although we're exploring a potential case, waiting some additional information on that. So, next slide, please. Here you can see our demographics. Again, our median age was 50 years old, and that's reflected in that high bar chart there for the 50 to 59-year-old age group. And females a little bit more being infected than males. And by race and ethnicity, predominantly white, non-Hispanic. We are disproportionately represented based on our county race and ethnicity demographics among cases in Hispanics of all races. Statewide, Hispanic and certainly Latinx youth are disproportionately represented, or certainly disproportionately at risk for infection or COVID. So that is a statewide area of concern. And the case status, 98% of them are confirmed by PCR testing. There's a couple that all indicators are that they have the infection, they just didn't get tested for a reason. Hospitalizations, we're doing fairly well in hospitalizations, although we have had a couple in the last 2 weeks. I believe one was at Parker Adventist, and I believe the other was at Skyridge. Just want to acknowledge the great work that both those hospitals are doing in taking care of our citizens, not only for those that are hospitalized, but also particularly want to acknowledge Skyridge, who has been very, very accommodating when folks needed to be tested in the moment, particularly public safety and first responders that can go to the emergency department and get tested and get the results quickly. So it's critical for them to limit their downtime, obviously, when they suspect they may have been exposed. Okay, so as of yesterday morning, or as of yesterday, Colorado and CDPHE have transitioned to a new dial framework. And the intent for this framework is to make it more easily understood the status of where the county is in terms of the number of new cases, the percent positivity of those tested, and the impact on hospitalizations. So this dial is adopted from the fire risk dial that most folks have probably seen, particularly in the summertime, perhaps outside a fire station, and is just a quick snapshot that indicates where particular counties are, and they have also added this content to the CDPHE COVID website so that folks can easily access it there as well. The framework recognizes the unique local circumstances using this dial to visualize a community's success in containing the spread of COVID-19 by increasing simplicity and predictability. Local communities have another tool to make life amidst the pandemic more sustainable until we have a major breakthrough in testing or treatment modalities or a vaccine. So the dial includes 5 levels, from least restrictive in green, protect our neighbors phase on the left, to most restrictive in the red, stay at home phase on the right. For purposes of where Elbert County will be for the foreseeable future, we will not be at either end of the dial. So let me explain that. Protect our neighbors in the green phase. To date, there have been, I believe, 6 counties that have requested and been granted protect our neighbor status. So those are Moffett, Rio Blanco, Mesa, Gunnison, Gilpin, and I believe Broomfield. I'm not sure about Broomfield. I'm gonna say no on Broomfield. So five counties. One of the prerequisites to transition to protect our neighbor status is a strong public health infrastructure. Currently, Elbert County Public Health does not have that. Currently, we are just 2 FTEs, myself and our environmental health specialist, and then we have our contact tracer on contract. The linchpin that we need is a public health nurse. One of the requirements for Protect Our Neighbor status is a robust COVID testing program. Without a public health nurse, it is impossible to conduct any level of testing. I am not clinically trained. Our environmental health specialist is not clinically trained. So that right out of the gate eliminates us. Again, we do have a public health nurse position and vacancy posted. It's been posted since July 1st. I encourage anyone that's listening to share that career option with any nurses that they know of or that may be interested. Unfortunately, we have not had any applicants thus far for that position. So we're continuing to brainstorm on how we can attract viable candidates for that role. On the other end of the dial framework on stay at home, I do not see that happening in terms of any county really transitioning to stay at home, simply because of the extreme challenges and hardship that was presented when the stay at home order was issued back in March or April by the governor's office. And the governor has commented that he would not let the state devolve to a point where another subsequent stay-at-home order was necessary. So for Elbert County, we will hopefully stay in the level 1 cautious. The level 1 cautious is for counties with low virus transmission that have not yet achieved protect our neighbor status. The level 2 area of concern, that's the baseline. Communities in this status are able to practice greater social distancing than in confined indoor spaces. And I should mention that, and you know, I can't put my hand. I'll share some of the metrics for these various levels. So the level 1 cautious can have up to 75 confirmed cases of infection per 100,000 population in that 2-week window, that 2-week rolling window. This is an easement from the previous level that CDPHE had, where that maximum level was 25. If a county had more than 25 cases per 100,000 population in a 2-week window, we transitioned to the old metrics were kind of low, medium, and high, and so we would have been in a medium phase. To stay in the level 1 cautious, we would need to have no greater than 5% positivity and either stable or declining hospitalizations. For the level 2 safer at home category of concern, new cases would be in the range of 75 confirmed cases, between 75 and 175 cases in a 2-week period. For perspective, I don't know that we have really ever spent much time, if at all, in that historically in Elbert County, in that volume of confirmed cases. So we're teetering on the edge of a couple things, but I don't think we're there yet. And the percent positivity, the maximum percent positivity would be 10% in level 2 area of concern. And then the hospitalizations may be increasing, they may be stable, they may be declining. The level 3 high risk, I would anticipate only those counties, barring some unforeseen and significant outbreak in schools or perhaps skilled nursing facility or something like that in Elbert County. Between 175 and 300 cases in a 2-week period per 100,000 population. I think there's only a couple counties that have really ever entered this level 3, what would now be considered level 3. And then percent positivity, no greater than 15%. So certainly just a few cases in a short period of time can cause that needle to waver, kind of on that border between level 1 cautious and level 2 concern. The intent is for counties to stay in the particular level for a 2-week period. If we were to, for whatever reason, transition in a negative direction towards the level 2 area of concern, the downstream implications for that, or the local implications for that, I should say, would be more restrictive measures in terms of what gets approved for community events, community gatherings, things like that. Currently, or historically, I should say, we have limited gatherings, both indoors and outdoors, to 100 attendees and participants. If we stay in this level 1 cautious area, that will certainly be eased. So probably, for example, upwards of 150 people outdoors and maybe 125 indoors. And by the way, CDPHE has come out with additional guidance on indoor and outdoor gatherings, with the understanding that the social distancing, the number of people, particularly indoors, per square footage available on the indoor facility or venue, still must accommodate social distancing. If it's indoors, they would still have to wear masks. Anyone with symptoms would not be allowed. So those things are evergreen. They will not change. Next slide, please, Eileen. And this is probably what I should have proceeded to, just a quick explanation of the DIALS framework. So yeah, you can move on, and there are some of the metrics and some of the considerations. Just to look at that previous one, please, Eileen. The different places of worship, education, restaurants, offices, gyms, all those things. Again, we're looking at percentage of capacity for those venues. Next slide, please. Yep, and we covered this as well. Okay, So our current public health orders, by way of update, we remain in the Safer at Home and in the Vast Great Outdoors 10th amended order. Again, we do not have the requisite capacity for the county to move to protect our neighbor phase. This past weekend on the 12th, the governor extended the statewide mask wearing order. As a reminder, that requires all Coloradans 11 years and older to wear a mask when they're in indoor spaces. Masks work, and the mask order will be in effect for 30 days, so at least until October 12th. Okay, so transitioning to other work that's going on at the health department, because it's not just all about COVID. Unfortunately, we have neglected a lot of the other work, so I'm pleased to be getting back to some of the other population health initiatives that are affecting our community's health. One of those, unfortunately, are deaths by suicide. So to date, in 2020, there have been 7 deaths among Elbert County residents by suicide. That is, for historical context, that is a high number for a 12-month calendar year. Most of the cases most of these 7 cases have been male, over 35, and the mechanism fatality is a gunshot wound. Historical reasons for deaths by suicide, not necessarily commenting on the deaths this current year, are someone experiencing a recent crisis, physical health concerns, and intimate partner problems, typically that have involved a recent episode of intimate partner violence or domestic violence. I want to point out that if anyone knows someone that's in need of accessing resources for mental health concerns, please ask them to connect with their primary care provider or with Centennial Mental Health in Elizabeth, and the number and the website are there. By way of asking for additional resources and support, I have connected with CDPHE's Office of Suicide Prevention. They have sent some historical data for suicide, death by suicide in Elbert County, I believe dating back to 2004. We're in the process of working through those numbers, and I anticipate having a call with them this afternoon. One of the, I think, proverbial low-hanging fruit approaches that we can start with involves mental health awareness, destigmatization, and suicide awareness among our veterans that have served in armed forces. And I'll be connecting with the Veterans Affairs contact for Elbert County, so that first we can get understanding or count of how many veterans we have in the county. And I would anticipate some type of veterans survey, either through an online survey tool like a SurveyMonkey or something like that, targeting veterans to assess their experiences with mental health challenges, behavioral health challenges, suicidal ideation, things like that, so that we can let the data guide us in our approach. And also just a general awareness and understanding campaign, because it is such a complex issue for folks to understand. A big part of the process is, again, the destigmatization and the recognition that we need to take care of our mental health and behavioral health challenges that we all have at one point or another. in the same fashion that we do our physical health concerns and challenges. Next slide, please. I want to encourage everyone to get a flu shot. Flu shots are now available. Why is this important? Well, during the winter months, the colder months, when people are spending more time indoors, the volume, the incidence, and the volume of flu infections rises seasonally, and flu symptoms mimic those of COVID symptoms. If you go to a physician when you're not feeling well, one of the first questions they're going to ask you in your medical history and your assessment is, have you had a flu shot this season? And if the answer is yes, I have had one, that helps them differentiate a little bit in their diagnosis in determining whether or not you are experiencing symptoms consistent with COVID or whether it is flu. And I can almost promise you it's going to save you money in unneeded tests or labs if they know that you have already had a flu shot. So flu season normally starts in October. It peaks during the winter. It is quick, it's easy, and do not wait to get a flu shot. Also, we understand that many families in the county experience ongoing challenges with regard to secure access to food. So I want to mention that the pandemic electronic EBT, electronic benefit something, I forget what that T is for, but pandemic EBT benefits are available to help families buy food to make up for meals students missed during school closures in the spring. Applications are being accepted at the website there, coloradopeak.secure.force.com/PEBT through September 23rd. If a family received SNAP benefits, that's the Supplemental Nutrition Assistance Program in March, April, and May, your pandemic EBT benefits may automatically have been added to your existing EBT card in July. But families with eligible children who were not receiving SNAP benefits during those months or who did not receive the automatic issuance should apply for the pandemic EBT benefits online. And per the flyer I'm looking at, you can receive up to $279 per eligible child to help stretch your food budget. So please encourage folks to take advantage of that resource and opportunity. Next slide, please. My contact info is there. Anyone that would like more regular updates on COVID, I do send out a daily situation update via constant contact email. They can simply email me with a request to be added to that. It's quick, it's easy, probably takes less than 2 minutes to read from start to finish. So if you're interested in more regular information, please let me know. And not on the agenda, but it came up this morning in a call with CDPHE, and that is the high school football conversation that was stirred up, I'll say, by the governor, unbeknownst to CHASA and high school football coaches and things like that. So I can tell you, kind of hot off the press, the governor believes that the high school football conversation is an extension of local control for school districts. While the process is not what CDPHE and some others, including some coaches, had wanted, I understand CHASA is making a decision this afternoon on resumption of high school football this fall. My notes just reading my notes, it says CDPHE will issue an approval letter. CDPHE will issue an approval letter for resumption of high school football, provided the organized sports guidance can be followed and adhered to. So there is a document from CDPHE for organized sports. It presents challenges, however, due to the limits, presents challenges for football, less so for some other sports, due to the limits on participation. So for example, a local county would need to be in level 1 in that COVID dial. Level 1 safer at home, have groups of up to 50 players, 50 players participate. If they're in level 2 status, they would only be allowed to have groups of 25 players. So maybe not so much of a concern for some of our schools in Elbert County that are playing 8-man football, but for the larger high schools, which in our case would just be Elizabeth and the competing schools in their respective conferences. And then lastly, sorry to be jumping back and forth. We did get an update on modeling, COVID modeling this morning as well. The reproductive rate is currently estimated to be just over 1. So for every infected individual, they are infecting 1 more person. Social distancing estimate statewide is currently about 65%. That's right at the threshold. The virus tends to proliferate when social distancing drops below 65%. Statewide, there is some concern. Outbreaks are continuing to grow in nursing facilities and correctional facilities. Statewide positivity rate for tests as of the 15th of September was 2.92%, and Elbert County is a little bit above that. The approach going forward is to focus on pockets of data rather than a statewide look at data. So more geographic specific incidents of COVID infection. And I'll stop there and be happy to answer any questions or comment in greater depth on anything I covered.
Grant, excuse me, Rick, you have any questions or comments?
I don't.
I don't have any comments either. Just thanks for the information.
Yeah, thank you, Dwayne. I'm glad that after all these months, the state's finally willing to look geographically at pockets, or what we would call local information for that decision making. On the public health nurses, that specifically, I mean, I know we're advertising for a public health nurse, but would an RN of another specialty with clinical certification would work as well? So
Yes, thank you for reminding me of that. I tend to say public health nurse, but as long as the nurse has current licensure in the state of Colorado, current nursing license, yep, that'll work. Thank
you, and appreciate the, kind of raising the issue of the number of suicides we are seeing. So I think in a whole, the county does a good job, folks, of looking out for each other. And I think just the job loss, economic impacts, marital issues that can spring from that, is we're seeing that effect. So just for anybody listening or out there, just kind of look out for people, and if somebody needs help, see if you can urge them to get some help. Not really for this meeting, but I know we've got postured ready to post the CARES Act business grant applications, and I think the nonprofits to follow quickly beyond that. So again, Dwayne, do appreciate the detailed update, and looks like things are kind of moving along in some cases in the right direction and some not. But with our numbers are so small, they tend to rise and fall quickly with just a few cases one way or the other. So I do thank you for your time.
Thank you.
If there is nothing else, I'd accept a motion to adjourn.
So moved.
I'll second.
Okay, we have a motion and a second to adjourn. All in favor, please say aye.
Aye.
Aye. I've got the time is 12:52. We are adjourned. Thank you.